It's safe to say if you're a parent whose child struggles with constipation, you've probably heard of Miralax. And while it's prescribed and used often, it is rarely a parent's first choice when it comes to dealing with a child's constipation because of all of the documented side effects, including behavioral struggles, dependency, and increased bloating, cramping, and gas, just to name a few. Miralax is not a tool that's needed for constipation, and many safe and effective tools and alternatives exist. The primary causes of constipation in kids are 1, the signaling, that brain-gut connection, and 2, motility, that movement and that plumbing of the fluids. So what is Miralax? Miralax is designed to help hold more water or pull more water from the stool back into the digestive tract. This often helps the stool pass more easily because it's softer. Now, Miralax comes in a powdered form that is usually mixed with water or juice, and while dosages are recommended for adult use, it's recommended that you reach out to your provider for specific dosages for children or kids under the age of 17. Now, Miralax has been a point of controversy for years after the FDA conducted a study in 2014 and found that 167 kids taking Miralax had severe emotional and psychiatric side effects, although many use it regularly or even daily to treat digestive issues. Its current use in kids with constipation is considered off-label. What does off-label mean? It means that it's being used for something or a reason other than what the FDA approved it for. The main ingredient's mechanism of retaining water works against the body's natural process of nutrient and fluid absorption. While altering this process may provide temporary relief, in the long run, working against absorption not only alters the biochemistry of the body, but also the brain's communication with the digestive tract. Let's first explore the causes of constipation in kids, and then we'll dive into the natural alternatives that are safe and effective for addressing chronic constipation. The first cause may be limited signals from the brain to the gut and the gut to the brain, which is primarily directed from and by the vagus nerve. If the body isn't getting that parasympathetic or that calming signal from the brain to the gut, the rest, relaxation, and digestion all take a back seat. Put in another way, these kids are simply more in a fight or flight state than a rest and digest mode. Now, the second cause may be a lack of motility and movement. You can nickname this easy plumbing. When smooth muscle gets consistent sympathetic fight or flight signals to it, it's not going to move as well, and it's going to get less hydrated, which means all of the contents aren't going to move through or pass through the digestive tract as easily. Instead of using medication to address the hydration or the softness of the stool, let's first address the cause. Let's first get those signals working from the brain to the gut using neurologically-focused chiropractic care. Then add the natural remedies to an already balanced, regulated, and signaling brain and gut connection, such as plenty of water, magnesium, probiotics, enzymes, and limiting sugar intake. If your child is struggling with chronic constipation and you as a parent want an alternative to medication, seek out a neurologically focused pediatric chiropractor. While we know that chronic constipation is common, it definitely isn't normal. So if you know another parent whose child is struggling with the same thing that we talked about in this video, please pass this video along, share it with a mom or dad who needs to hear this information. And if you have any questions, please drop a comment below or send us a direct message. Thanks for watching, and we'll see you on the next one.